Hi, I'm Jason Shenefield. I'm the president and CEO of Phelps Health. In my role at Phelps Health as the CEO, the things I really enjoy are just the diversity of challenges that we get to solve problems for, the number of people that we get to work with, and just knowing that with over 1,900 employees, we're one of the largest economic drivers in the community and the region, and it's just a privilege to be able to serve in that capacity. So I became interested in healthcare when I joined the military. My plan when I went into the military was actually to develop skills to become a police officer. But as I got into boot camp and was placed into my career, I was actually placed as a hospital corpsman, which led me to my job being primarily as a clinical provider, taking care of patients in the recruit training command. And that was really my introduction to healthcare. The thing I enjoyed the most, though, was early into my career, probably by 21 or 22, I actually led a team at the clinic of more than 20 military members. And what I found was I really enjoyed leading people or a group of people to a common mission and achieving our goals on a daily basis. And just throughout my career, I've continued to develop that passion for leadership, with healthcare really being my area of expertise. My leadership philosophy is really based off of being supportive of those that work for an organization. I feel like the people within any organization shouldn't be there to support their leaders, but really the leaders should be there to support them in a way to ensure that they're successful and that they're happy in the work that they do. We should find ways to break down barriers whenever they have challenges at work. And it's a constant challenge, but I feel that my philosophy is really just to be of a supportive nature and really ensure that the work that everyone does can be done to the best of their abilities, and that we don't create problems, but we actually help solve them. I choose Phelps Health because of the unique mission that we have to serve to our community. We're in a unique position because we are a large healthcare provider in a rural community. Not many communities are as fortunate as Rolla and the Phelps County region to have a healthcare provider such as Phelps Health. And I just feel that it's important that we're here to provide the best quality healthcare possible, and that we serve the people in our region to meet their healthcare needs on a daily basis. The best piece of advice I have probably received in my career is actually from a physician I worked with who was an anesthesiologist. And he had came to my office one day, actually as I was getting ready to leave that organization, and he told me that he saw that I could continue to be very successful as a healthcare executive, and that for me to be successful, to maintain two of my qualities that he always appreciated. And that was really to always remain kind and to remain humble in the work that I do. And that's something that I really strive to be consistent with, and it meant a lot that he recognized that and that he valued it, and that he felt that it was a key to me being successful in my career. Throughout my career, I've actually had several heroes. Many of them were various CEOs that I've worked throughout my career. And what I've found is I've learned a lot of very good traits and qualities. I've witnessed a lot of meaningful work that has been done. And so really I can't pin it down to any one person that is my hero, but it's really the culmination of watching and learning from really effective executive leaders throughout my career. And I just think that that's a huge benefit to me, and something that I truly value, because they probably didn't realize how much I was studying and learning from them. But a lot of what I do today is based off of the things that I saw that went well, and also things that I saw that may not have went as well, and trying to find ways to improve upon those learnings. Currently in the healthcare industry, there's many challenges that many healthcare providers, including Phelps Health, face. Recruitment and retention of healthcare staff is one of the biggest challenges that are out there. We're really working hard to create a workplace environment, really starting with the culture to be a destination place to work, and also looking at the things that we also know are important, which is compensation, benefits, and the things that attract people to Phelps Health. We're also challenged with a lot of the reimbursement challenges that are going on throughout healthcare. At Phelps Health, we're really working on how do we become as efficient as possible. We know that reimbursement is going to continue to be a challenge, and we just have to, as a team, find ways to be efficient in the work that we do. We're also challenged with the gaps that exist in our community, with gaps in behavioral health and substance abuse, and finding ways of better coordinating access to care before individuals are at a point of crisis. And we're here to provide emergency medical services, but it would be much better for the community if we could intervene before people need to arrive at an emergency department for care. One of the other challenges that we have is the constantly changing regulatory environment. We always strive to stay compliant with the regulatory changes, but one of the challenges is that they often come quickly and we have to learn to adapt, and it makes it challenging to stay focused on the priorities of our patients with the core things that we want to be doing, but our goal is to always remain compliant and adapt in an environment that is changing faster than what sometimes health system can keep up with.